a good feeling.
Hey everybody, we are here with Dr. Jared and one of our great patients, Ron Kolpa. And Dr. Jared, talk a little bit about what you're doing right now on Ron's leg.
Well, as you see, Ron here is in pretty darn good shape for as mature as he is. And he works these knees pretty darn good in what he does. So throughout, he gets a lot of scar tissue built up through this quad, which really takes this kneecap and even the knee joint itself and kind of smashes it together. And with him continuing to be incredibly active, knees start barking at you a little bit from time to time?
Yeah.
Absolutely. So what we're doing here is Graston Technique, soft tissue technique, that does quite a few things. Right now we're opening up this quad to give more space at the patella or the kneecap, as well as the knee joint. So when Ron's working, run around doing what he needs to do, he can do that without experiencing pain. Other thing that we're going to do is, as we get a little bit closer to the knee joint, is we're going to increase a lot of blood flow. Blood flow is going to do two things. It's going to clear inflammation, it's going to clear bad things, but it's also going to bring that kind of the healing properties to increase his healing potential at these joints, so that hopefully this isn't something that you have to do for the rest of your life. Even though you love this so much, don't you, Ron?
Oh, that's great.
Oh, that's great.
Now, Health Performance Center is one of only 3 facilities in the St. Louis area that does the Graston Technique.
According to Ron, we're one of 2, aren't we?
Down to 2, yeah.
There we go. No, it's one of those things where you have to have the understanding of how to apply the technique, but also the people in the clients in the practice who will respond to it. And we have a lot of active people here who really respond to Graston Technique. These tools are fairly expensive, but with the people that we have in here and the value that they add to our clients, we're happy to be one of 2 in St. Louis.
And Graston just isn't for the athlete that is, working on rehabilitation and things like that. It's for anybody that has issues with their legs or knees. I know you've actually done Graston on my plantar fasciitis on my foot in the past.
Absolutely. Talk about athletes getting it, and obviously they're using their bodies and stressing them highly, but people sitting at desks all day or in the same posture for a long period of time, they have equal types of stress. It's not high intensity, high damage, but it's more of that long-term postural change that they need, again, that increased blood flow, increased range of motion. So absolutely, I'm going to pretty much hit about 50-50 athlete to non-athlete with Graston.
Once again, Dr. Jared talking a little bit about some of the things that we do here at Health and Performance Center. Thank you so much, Doctor.
Thank you.
And thank you, Ron.
Thanks, Ron.